In this video, let me talk about the constriction ring, which is also called as a Shridhar ring. Before getting into details, let me explain you. We know there are three layers in the uterus. This is perimetrium is the outer layer, and the myometrium is the innermost layer with the muscle fibers. This is going to act so much during the contraction, the labor pain. And this is the innermost layer, is endometrium. So, one more thing you should know is normal contraction occurs where? If this is going to be the uterus, this is a fallopian tube where this is going to be the corner of the uterus where this fallopian tube is attached to the uterus. Here is the tubal ostia and the pain starts in this way. It spreads throughout the uterus. Not only the contraction, the retraction also occurs. The muscle fibers also shortens. Okay, so what is it? It is a localized myometrial contractions. Localized means it is not throughout the uterus, it is only in one part it is. Okay, localized myometrial contraction forming a ring of a circular muscle fibers of the uterus. Particularly where? At the junction. This is a junction. Okay, junction of what? This is upper uterine segment and this is the lower uterine segment. So this junction it occurs. So there's a constricted part over here, especially at the neck part. And you call this as a cephalic presentation because we know presentation means the fetal part which is at the lower pole of the uterus is called as a presentation, has head of the fetus is at the lower pole, head is called as cephalic, that is why it is a cephalic presentation. Okay, fine. So in the cephalic presentation only this constriction ring occurs. The size and the shape of the ring is unaffected by the contractions. May be or may appear in all the stages of the labor. We know there are three stages in the labor, the first stage, second stage and the third stage of labor. First stage of labor starts with the pain, labor pain till 10 centimeters of the cervical dilatation until, when that's going to be completely dilated, till the fetus delivery is the second stage, and after the fetus has been delivered, till the placenta has been delivered, that is going to be the third stage of labor. So it may occur at any stage of labor. Usually it is reversible and complete. What are the causes or etiology of the labor? Injudicious administration of oxytocin. Injudicious means it is over the limit, uncontrollably. So what happens is this oxytocin acts on the receptors in the fundus of the uterus. So when this oxytocin is received, immediately muscle contraction occurs. If there's more oxytocin, receptors receives. So what happens is more contractions occurs. That is called as a hypertonic of the uterus. If it is going to be more and more and more. Okay, so if you're going to, if the patient has been administered more of oxytocins, this might be a cause for the constriction ring. Secondly is a prolonged labor. The labor is prolonged. Let me talk about the primary mother because their timings in the labor is more. Okay, so that's why we're going to compare it. Okay, in the first stage and the second stage and the third stage, as I told you, this constriction ring can occur at any stages of labor. So the first stage, around 12 hours its maximum it takes in the primary mother, and second stage it takes around 2 hours, and the third stage is around 30 minutes. So if this hours exceeds, that is called as a prolonged labor. Premature rupture of membrane. Rupture of membrane is rupture of membrane. Okay, so what happens when the amniotic bag leaks out, the fluid comes out. So this is called as a rupture of membrane. So premature means before the labor pain starts, the rupture occurs. That is called as a premature rupture of membrane. So what happens at that time? The fluid which is in the amniotic bag, it should be around 800 ml to 1000 ml. It is supposed to be. If there's going to be a leak, what happens? Almost all the fluids comes out. And oligohydramnios is also another reason for this. Oligo means it is less. So it's supposed to be 800 to 1000, but it is less than 300 ml. That is called as an oligohydroamnios, amniotic fluid. So in both the cases, what happens is this amniotic fluid index is less than 1 centimeter. So how do you find this amniotic fluid index? So the abdomen is, ultrasonography is done on the abdomen, and it is divided into 4 quadrants. 1, 2, 3, 4. So what happens is when it is through ultrasound, we could find out how much of the fluid is. So almost all the pockets, it should have 5 to 25 centimeters is a normal one. Okay, this is called as amniotic fluid index, and if it is going to be less than 1, means almost all the fluid is leaked out, only less than 1 centimeter. In that case, this constriction ring occurs. Premature attempt at the instrumental delivery. Okay, what do you mean by the instrumental delivery? Instrumental delivery, nothing but it's a forceps and ventouse cup, a suction cup it is. Okay. Okay, premature attempt at instrumental delivery. Okay, let me draw a pelvis for you. This is a pelvis, female pelvis, or very poor pelvis, but yeah. Uh, okay, this is of pelvis. This is ischial spines. So when the fetus head comes and reaches over here, this is called as a zero station. If it is above that, this is -1, -2, -3, -4, and here till the brim it is -5. So same when it is reaches beyond the station, +1, +2, +3, or till +1, +2, +3, +4, +5 is going to be. I mean, it is uh, out of the pelvis. Okay, so what happens is it's supposed to be when the instrument is being applied, whether it is going to be ventouse, otherwise forceps, it should be beyond the stage zero station. So normally it should be. In case if it is somewhere around the normal one, ultimately it leads to a constriction ring. Occipital posterior position. This is a pelvic brim. If it is divided into 4 quadrant, I mean, it's not a quadrant, it's anterior or posterior. Normally what happens is, this is a fetus skull. Posterior part is a triangular one, and anterior part is this is a diamond shaped fontanelles, right? So same thing, this is supposed to be normal. This is left or right, whatever it is. And this is going to be normal position. But if it is going to be present at the back side, I mean, if the occiput is going to be at the posterior part and this is an anterior fontanelle, so in this case, what happens is it has to travel a long distance, means during the mechanism of labor, it has to rotate and it has to reach over here. So in that time, what happens? This constriction ring occurs. How do you diagnose? It's very difficult to diagnose. The only option is USG, ultrasonography. It can be seen actually during the cesarean section in the first stage. So during forceps also, in the second stage, we could see that. And at third stage, during the placental delivery also, we'll be able to find it out. You could find this hourglass contraction, means hourglass contraction means it's a constriction ring will be formed at the center due to the abnormal muscular contraction, that is called as an hourglass contraction. Okay, the ring is not felt per abdomen. That is why it is very difficult for us to identify. The fetus is rest, of course, because of the hypertonic, means because of the oxytocin, the contraction has exceeded more than normal limit. But the uterus never ruptures. What the treatment is? It's a tocolysis. Toco means it is uterine contraction, the medical term. So what is lysis is? Lysis means it is a breakdown. So how could you reduce this uterine contractions or the labor pain? By the tocolytic agents like nitroglycerin. It might be injectables, otherwise it might be patches too. Or magnesium sulfate is a drug of choice. Caesarean section and forceps delivery also is helpful. Deep anesthesia is required, and especially in the forceps delivery in the second stage, or during the normal removal of the placenta in the third stage. Please see the description to see the other important topics in the description.